All right, we're going to be doing a treatment for the posterior leg, specifically for gastrocs and soleus in this video. So we're going to be getting into some palpation and seeing how the tone of gastrocnemius and when it starts turning into more of a tendon up in here, as well as underneath it, the muscle known as soleus and its musculotendinous junction working its way down into the calcaneus. We've done a little bit of a effleurage warm-up already, so I'll just kind of continue with that. I've already put some oil on the surface. I'm going to start off with some effleurage, and then I'm going to get right into some deeper strokes. So this is kind of choose your own, what you prefer. So you can have some palmar, some reinforced palmar, some fingertips, and just slowly work through your kind of surfaces and your layers. I'm going to switch over to some knuckle. Now I have most of my pressure coming in through my knuckles, but sometimes I follow along with my palm just so I can feel what's happening underneath the surface. Again, like so. And then I can easily switch over and go more on the medial head of gastrocs here. I find it important really to try and keep my wrist as straight as possible when I'm doing this. So I'm going to just move myself around. But if I wanted to get this outer, that's going to put a lot of strain on my wrist here. So it's just easier for me to switch over. If you feel like the leg is moving around quite a bit, then you might want to anchor onto that. So again, holding on to the lower part of the leg and working my way up through some knuckle stroking here. Okay, let's transition and work into something a little bit more. So we might try to kind of individually work on a head. So some people will like a dual thumb stroke right up through the center of the two gastrocnemius heads. If you're making sure you're right in the correct muscle tissue, you might ask your person throughout that just to do a very gentle plantar flexion like so. So if she holds that, this is the bottom of her medial gastroc head right here, and a little bit shorter on the outside is the bottom of the lateral. So I'll place my two hands. It kind of looks like so, the medial head of gastrocs and the lateral. That's pretty stereotypical to see people with a lower medial head. It drops down a little bit lower versus that lateral head. Now both of these muscles are originating on the back of the femur. So besides kind of getting into the muscle bellies here, you're going to also want to warm up the back of a person's hamstrings and then try to dive down towards the back of the femur. So make sure that you've done some hamstring warm up, especially semitendinosus, membranosus on one side, and then your two heads to biceps femoris on the other side. Now, if you're finding that you can't push down to the back of the knee, you're going to want to slacken all the knee up. So I currently have just one pillow in place right here, which is supporting the ankle and the foot, but I might want to put a second or even a third pillow underneath to raise that up. So I just happen to have another pillow close by. I'm going to raise up the ankle. I'm going to add another layer of support. And the further you bring this up, the slacker it's going to be through the back of the knee, because the hamstring's main function is to do knee flexion. So again, I can try that with the additional pillow in place. If I still feel like it's not quite soft enough for me to get down towards that origin of gastroc, I might actually just hold the leg up. So with one hand, I can hold up and then I can sink down through the hamstrings towards the origin of gastrocs in here. Now I'm going to have her just do a little plantar flexion again, like so. Good, and relax, and do that another time for me. And then when you find it, you can get onto more of that gastrocs musculotendinous junction and the tendon of that going down. How are we doing on our pain scale right now with my pressure here?
Good.
So just be mindful about your pressure into the back of the knee and the popliteal fossa, because we do have your tibial nerve and popliteal artery, so it can get a little bit sensitive with too much pressure in here. So let's go over to that lateral aspect now. Same idea. Make sure the hamstrings are warm enough for us to get into that space, and then sink down. Again, ask for a little plantar flexion. Good, and relax. And again, another plantar flexion for me. Good. So I can identify that muscle belly moving. And I'm just going to do a little point pressure in here. You could call this a Golgi tendon organ release. as I'm trying to push and hold sustained pressure into that gastrocs musculotendinous junction. Okay, let's bring this back down. Besides a lot of compressive techniques, I also like lifting up on the gastrocs. So again, we can use something as a quick warm-up. Some people call this open C kneading. So we can go on either side of this gastrocs. And I really like doing ringing and picking up. So what I'm gonna do here is I'm gonna take away one pillow, but I'm actually gonna lift up the bottom sheet and put my knee underneath. So I'm really starting to slacken this up a little bit for me. That makes it a lot looser for gastrocs and soleus, as you can see here. So then I can use a one-handed scoop and really try to pick up that gastrocs without having to hold it myself. So I can loosen up gastrocs, and this is going to be really important if I'm going to want to get down onto soleus. I'm just going to change my position a little bit here. So again, using my outer hand to help lift up a lateral gastroc versus my inner hand to pick up a medial gastroc. Okay, good. And again, if we wanted to try something a little bit deeper in here, I'm going to give her to do a little plantar flexion. Good. And I'm going to be using my knuckles this time. I'm just going to be sinking in, trying to do a little bit of quick belly stripping. So notice my pace is slowed down considerably here. I am using more pressure. This could get higher on a pain scale, so we're going to check in. What are we doing on our pain scale?
4.
About a 4. Okay, so that is quite a bit. So I'm going to back off my pressure. There's no reason for me to go all straight down to a 4 on the first pass of this, even though I have done some warm-up. So we'll try that again. How are we at with this one this time?
3.
3, okay. Again, just a little plantar flexion for me. Good. Yeah, I'm definitely inside the muscle belly here on that lateral gastroc. Just taking my time. You might come across some bands or little nodules with inside the muscle. Okay, good. So let's clear through that again with a few more strokes. And you could easily repeat that on the opposite side as well. Okay, I'm going to bring this leg down. So soleus, which is lying underneath gastrocs, is originating along this soleal line of the tibia here, as well as on the proximal posterior head of the fibula and its shaft. So to try and get at soleus, you definitely want to have the gastrocs loose. Now in some instances, what I'm actually going to do is come over to the other side of the table here. So I can hold with the outside of my hand. I'm going to try to scoop up underneath gastrocs and run my fingers along a slightly deeper layer here, as if I was trying to follow soleus. Again, this can get a little bit more intense because I'm trying to get down to a deeper level. Can you gently just do a little plantar flexion for me? Good. I can feel the muscle belly trying to push me out in this direction. Good. Again, if gastrocs is still too tight, we can lift this up. And similarly, I can try to run down. You can see how easy it is for me to push gastrocs out of the way this time. So this lets me access soleus a lot easier. And then if I wanted to get at the deep posterior compartment, that would be appropriate as well. Okay, so medial and tibial attachment. And then I'm going to try to push gastrocs over for that lateral attachment as well. So the fibula is here, running all the way up along is fibularis longus and brevis. Longus and brevis. I'm going to try to roll just onto the posterior aspect. And again, nice space for me to place my thumb and run it up along the fibular attachment of soleus. So just a slow stroke in that case. I have a feeling this one's going to be a little bit more sensitive again. So again, just a little plantar flexion for me. Good, and relax. And if I wanted to add a little pressure, instead of digging harder with my thumb, I might just place my fingertips on top of that. So I can use reinforcement from my other hand instead of really digging in and put a lot of pressure on my knuckle. So I can just place my finger, keep it flat to the body, and then reinforce with my other limb. Nice. Okay. So we've released kind of the upper attachments of soleus. We're going to work our way down into that Achilles tendon, just trying to blend some techniques. Again, do a little bit of open C kneading. Let's try to pick up this area here. And something I'd like to show you, which is kind of interesting, is we know that gastrocs has its musculotendinous junction right about in this area. And again, we saw that on the lateral. But soleus, sometimes it's hard to determine how far the belly starts to go down and where it's pure tendon. So this is a trick that I like to do. And what you're going to do is you're going to look at the foot and you're going to be looking for this kind of a motion. So if I'm in gastroc and soleus and I squeeze in here, you can quite easily see the foot moving along. If I go down a little lower, I'm still seeing that movement. I go a little lower, I'm still seeing that movement. I go a little lower, the movement's getting smaller. And when I'm in the pure Achilles tendon, there is no more plantar flexion that occurs when I squeeze just the tendon. So you can kind of tell where you're in muscle belly because of the motion that's happening within the foot versus when you're on pure Achilles tendon and then the bone. So in this area here, it's really nice to try and pick that up, massage on either side. I'm going to put this down a little bit. And again, run my fingers along the lateral aspect of the Achilles. And we can do the same thing on the medial aspect. Just trying to release the muscle fibers as they're attaching into this tendon. This area gets quite tight. A lot of individuals have a lot of tension built up. Achilles tendonitis is a very common condition. So you want to spend a lot of time manipulating the muscles attached to it because again, they're pulling on this tendon, putting a lot of pressure through it. So we can check the tendon and see how tight it is. So I'm going to take the weight off of it, but I want to feel a medial and lateral motion of it. If this is really restricted, some people want to do some bowing. Just going to position my thumb on one side so you can take a look. I'm going to load pressure into it and you might sustain. We're going to see which way moves easier and on the foot. And sometimes you can even just look at a person's foot and evaluate if they have more pronation or supination in their foot, depending on how much stress there is across their Achilles tendon. So we can try to do a couple strokes on the actual Achilles itself. And then we're going to get into some work just on the actual bone itself. So sometimes when you say you're massaging bone, it's kind of a weird statement. I'm not putting hard pressure on the bone, but I am just treating some of the skin and the fascia over top of it, which usually feels nice. And then you definitely want to go on to the plantar aspect of the calcaneus and start to do some work in there and into the fat pad a little bit. So I'm going to use my knuckles a little bit and just do a few strokes and some kneading into the plantar aspect. I'm not going to get too much into plantar fasciitis and the treatment of the plantar fascia. However, that is often another location where people are going to have some pain and some discomfort, especially with their tight gastroc and soleus. So we'll leave that for another treatment kind of in the future. All right, I'm going to do just a couple range of motion and length checks here. I've done this before, but I'm just checking to see how that dorsiflexion is passively. This is lengthening out the soleus because gastrocs needs that knee extended. So we might go through some gentle stretching, just feeling for and feel the passive overpressure. And then if we wanted to, we could extend the knee and as well check that gastroc's length. Or I could do this off the side of a table if I wished. All right. Now that I've kind of checked and done a little reassessment of the length of this muscle and repalpated, it's just time to clear that out, and that's going to conclude our treatment of gastrocs and soleus for now. I hope you enjoyed this video.